Good morning, Mr. Mayor and councillors. My name is Kathy Mochnacki, and I'm the chairperson of the Board of Directors of Home on the Hill, Supportive Housing, a grassroots organization with a small supporting housing program, and other valuable programs which give support to families and their loved ones affected by serious mental illness. I thank you for your attention today as I respectfully ask that our comments about the grant program cancellation be recorded. I have an MSW in social work and a postmaster's diploma in social service administration. I have 15 years experience as a mental health social worker, both working in the community and in hospital. I stand here with Maggie Valkyr, program director and secretary treasurer, and a former psychiatric nurse. I stand with other board directors, some of who have medical and psychiatric experience. I also stand with program participants, leaders, volunteers, and parents. They are all part of Richmond Hill, where people come together to build our community. This morning, Home on the Hill has come to talk about the Community and Cultural Grant Program, of which our organization has been a most grateful recipient in the past. We want you, our City Council, to know how truly meaningful it was to have our last year's application approved, and how very proud we were to put the Richmond Hill logo on our website. We felt that somehow our small grassroots organization had arrived. We felt truly affirmed that our organization had been recognized by our very own municipal government. We knew that Richmond Hill had our back. Last year, the grant program funded the Robert Valkyr Lecture Series on mental illness. This is our signature program, which attracts noted psychiatrists, psychologists, academics, and other professionals to Richmond Hill. One well-known psychologist from Queen's University said that our organization was critically important and asked to come back in 2 years to present again. Our audiences, which consist of families, the police, health professionals, and members of the public, learn about the mental illnesses, the symptoms, and the current barriers to adequate care. Such knowledge helps families and the public understand mental illness and helps reduce stigma, but most importantly, gives those affected knowledge that is not always available to them in the current mental health system. No other organization provides such free information to the public on such a regular basis. On March the 18th, Home on the Hill will host psychiatrist in chief of St. Michael's Hospital, Dr. Tom Unger, who will discuss the Mental Health Act from a practitioner's perspective. Last week, Dr. Nick Cates of McMaster University presented on a collaborative model of care which will allow the system to tap the unused resource of the patient and the family and include them as part of the team. One of our most noted events was on de-escalation, given by Dr. David Dawson, which attracted representatives from most Ontario police services. These presentations are videotaped and made available to a broader national and international audience. This year, Home on the Hill applied for funding again from the grant program to help with the cost of running our peer recreation group. This program, which is led by a registered recreation therapist, runs on Wednesday and Thursday afternoon, where 2 groups of young men take part in recreational activities together, such as rock climbing, archery, go-kart racing, and gym. A spirit of camaraderie is nurtured, which offsets the isolation that can be caused by the illness and can lead to a downward spiral, leading to costly emergency services and hospitalization. The funding which your staff recommended was to go towards allowing people to live in the community, improving the quality of life, and building feelings of identity and self-worth that helps them face the challenges presented by the status of their health. And the families of those participants express appreciation and relief that their loved ones are meaningfully engaged. With respect, we would ask the Council to reconsider their cancelling of the Community and Cultural Grant Program, given this information that we have provided today. Thank you.
Thank you.